Hello, my name's Ian McCall. This is a short talk on papillary dermal edema. Now, if you're looking down a path slide and you see this degree of dermal edema, it indicates that it's a dermal process. There's nothing much happening in the epidermis here. And if it's a dermal process, then it'll be these diseases, see you later at the Department of Veterans Affairs, EV, that are going to apply. C for cellulitis. Cellulitis would normally give you a neutrophilic infiltrate in between the bundles of collagen here. In erysipelas, you can get quite marked edema, but there would be leukocytes that you'd be seeing. Sweet syndrome can look very much like cellulitis as well. It also can give a lot of papillary edema. In fact, you get the pseudo-blistering that's typical of certain types of sweets, particularly in the back of the hand. But again, it's going to be a neutrophilic and a massive neutrophilic infiltrate, often with the neutrophils penetrating the epidermis as well. Urticaria. Urticaria certainly can give edema in the papillary dermis, but there would be a lot of eosinophils that you'd normally be seeing as well. See you later. L, lupus. Bullous lupus can present with edema here, but there's usually quite a bit of damage at the dermal-epidermal junction, and this wasn't obvious in this particular picture here. L for a light eruption. Now, this papillary edema is a very typical feature of a light eruption, and often you get a superficial and deep, fairly tight perivascular infiltrate as well, which is what we are seeing in this. And these were lymphocytes, so it is a polymorphous light eruption in this particular case. However, working along, D for a drug reaction. Need to be a fixed drug reaction. Again, usually there's a lymphocytic infiltrate at the dermo-epidermal junction. There may be quite a bit of edema there, and we're not seeing it. A viral exanthem. Again, you can get a fair bit of edema sometimes with viral exanthems, but again, there should be that fairly marked damage at the dermo-epidermal junction. And a tighter lichenoid infiltrate there. Annular erythema, you can get a superficial and deep infiltrate in erythema annulari centrifugum or in deep dermal hypersensitivity. And in some cases, you can get edema, but not as much as this. At least I've never seen it. E for erythema multiforme, certainly you can get edema. I mean, this is subsequent to getting bullae. But again, there should be a fair bit of damage at the dermo-epidermal junction with infiltrate of lymphocytes into the overlying epidermis. We're not seeing that. V for vasculitis, not with edema like that. I for infiltrates, no. And E for erythema nodosum doesn't really give you edema like that. So looking along all of these, cellulitis, urticaria, lupus, light eruption, lichen sclerosus can certainly give quite a bit of edema, and I should have mentioned that. Some of the immunobullous diseases can also give a lot of dermal edema. For instance, in the pre-bullous phase of bullous pemphigoid, you may get, but again, you should get quite a few eosinophils in there. Bites from an insect bite reaction, again, you can get quite marked dermal edema, but again, there should be a more wedge-shaped lymphocytic infiltrate here, and again, quite a few eosinophils. So in analysis, polymorphous light eruption is the likeliest diagnosis in this particular case. Thanks very much.